Give me 5 minutes and I'll give you a clear way to tell if it's baby blues or postpartum depression, and the exact words to ask for help without shame. If you're running a household, caring for a newborn, and juggling a career, you don't need another vague pep talk. You need a plan. Let's make one together. Hi, I'm Cherry, a certified maternal and newborn nurse. Let's talk about postpartum depression in plain language, how it shows up, how to tell it apart from normal days of tears, and how to get real help that works with breastfeeding and a return to work timeline. I'll also give simple phrases to use with your OB or your pediatrician so you're not searching for words in the moment. The first 2 weeks after birth are a hormonal storm. Crying for no clear reason, feeling tender, a little anxious. That's often the baby blues. They usually peak around day 3 to 5 and settle by the end of week 2. If your mood stays heavy past 2 weeks, keeps getting worse, or makes it hard to do normal things like shower, eat, answer a text, look forward to anything, now we're likely in postpartum depression territory. As we go through the video, I will refer to postpartum depression as PPD. PPD can start anytime in the first year after birth. Baby blues drip, PPD sticks. Neither of these labels says anything about your character. They tell us about your brain chemistry and the support that you need. What PPD can look like, especially for working moms. Well, PPD doesn't always look like sadness. It can be a flat, numb feeling. It can be irritability that catches you off guard. It can be anxiety that never shuts off, even when the baby is asleep and the house is quiet. You may notice your appetite disappearing, sleep that won't come even when you finally have the chance, and a creeping sense that you're failing at everything. So on the outside, you might be keeping the train on the tracks, replying to Slack, prepping bottles, and smiling for visitors. But inside, everything feels heavy. Risk is higher if you've had depression or anxiety before, a complicated delivery, a NICU stay, very little help at home, or severe sleep loss. None of that is your fault. It just means your nervous system needs more care. If you're nodding along and thinking, this is me, I want you to know you don't have to figure it out alone. I put together a free private resource hub with tools like mental wellness workbook, short daily prompts, and simple systems that help you feel supported between doctor's visits. The link is in the description. So, here's how to get help screening and the exact words that you can use. You don't have to diagnose yourself. Ask for a quick screen. Your OB doctors can do this at postpartum visits using breath-validated questionnaires. This is part of your standard care, but a gentle reminder will not hurt. Your baby's pediatrician can also screen you at the 1, 2, 4, and 6 months well visits. Here are words you can use. I'm blank weeks postpartum, and I still don't feel like myself. Could we do a depression screen today and talk through options? If scary, unwanted thoughts are showing up, try, I'm having intrusive thoughts that worry me. I need help urgently. If getting into an office is hard, ask for telehealth and check your benefits. Many employers offer employee assistance, virtual counseling, and mental health coverage. You can start right away. If you need immediate support, please call or text 988 anytime. If you or your baby are in danger, call 911 or go to the ER or to the emergency department. So let's talk about what actually helps. Some evidence-based care that respects real life. Talk therapy works. Cognitive behavioral therapy and interpersonal therapy are first line for mild to moderate PPD, and many moms like starting there or combining therapy with some medications. Medication is not a moral failure, it's a tool. For moderate to severe PPD, antidepressants, often SSRIs, are very effective. Options like sertraline are commonly chosen when breastfeeding because infant exposure through milk is typically low. Your doctor will help you choose safely for your situation. None of these choices means you've failed. They mean you're getting your brain chemistry the support it needs so you can feel like yourself again. Make treatment work in a busy life. Practical scaffolding. While therapy and medications do their job, protect one sleep block each night. Someone else covers a feed, or you plan a pump and sleep window. Put meals on autopilot. Simple proteins, fruit, and hydration you can sip all day. Get daylight on your face each morning to anchor your body clock. Ask for help with chores that don't require you. If you're returning to work, build a simple transition plan. Who's covering nighttime care before your first day back? When you'll pump at work, and how you'll handle the end of the day crash. Small, consistent systems lightens the load so your treatment can work faster. So when symptoms are urgent, very rarely, symptoms can escalate into postpartum psychosis, confusion, paranoia, or delusions, hearing or seeing things that aren't there, or going 48 hours without sleep with racing thoughts. That is a medical emergency. Go to the ER or call 911 right away. You will not be in trouble for asking for help. You will be cared for. I like to clear the next steps. At your next appointment, say, can we do a postpartum depression screen today? And if my score is elevated, what's our treatment plan and follow-up? If you're breastfeeding, say, can we go over medication options that are compatible with nursing? If your return to work date is coming up, ask, can we map a plan for sleep, pumping, and support while I'm in treatment so I don't backslide? Needing help after birth doesn't make you weak. It makes you human. Postpartum depression is common and treatable. With the right plan, you can feel like yourself again, enjoy your baby, and step back into work on your terms. To make that plan easier, join my free private resource hub. It's where I keep all my best tools, like the mental wellness workbook, to guide you while your treatment starts working. The link is below. If this was helpful, watch this video next. It's a practical guide to lowering daily anxiety and pressure while your treatment starts working. Thank you for spending this time with me. Your postpartum season is valid. Your recovery deserves care, and your efforts, even the quiet ones, are enough. If this video helped make any part of your experience feel more precise or less overwhelming, I'd love for you to like this video and stay connected. And if you're ready for more support with a plan that actually fits your real life, you'll find everything you need in the link below. I'm Cherry, and I will see you in the next one.